New this morning, Americans getting their first look at how much they will have to pay for health care coverage under Obamacare next year. For many, it could cost hundreds, if not thousands of dollars more. With us now, Tami Luhby, CNN senior writer. Her story on this is up right now on CNN.com. Tami, always great to see you. What are you learning here? What's the price tag people are looking at?
Well, we now are getting a first look at what the actual premiums will be for those in the 30 states that shop on the federal exchange, healthcare.gov. Now, CMS and KFF released yesterday that overall premiums will go up 26%. That's what insurers, those are the rates insurers are charging. That's their increase. But because of the expiring federal subsidies, the actual amount that people will pay will be far more. So when folks go onto healthcare.gov now, they can look at their 2026 plans, and they're probably going to be pretty shocked at what they see.
When you say pretty shocked at what they see, and when we talk about the failure to extend the Obamacare subsidies, how much more roughly? And I know it depends on each plan and it depends on the individual, but what are we talking about here? If it's a 26% increase on overall premiums, they don't have the subsidies, which in and of themselves, I thought we were estimating could cause people 30% increases.
Right. Well, the insurers are raising their rates by 30%, but actually, according to KFF, the amount people are paying could actually more than double. They're thinking that the premiums that people actually pay because of the expiring enhanced subsidies will go up 114%. And there really is no way to say what the average will be. You know, it could be hundreds, thousands, as you say, but people will actually, people have been hearing about this for a long time, but many people until October did not actually know how much they were going to pay, but now those numbers are actually available on healthcare.gov. Window shopping opened late yesterday. And for those who live in states that run their own exchanges, they can go to their state exchanges. Many states have opened up window shopping, although not all. But open enrollment starts November 1st. So on Saturday, it'll all be evident.
It's just around the corner, just a few days away, and it sounds like there'll be some serious sticker shock. I didn't ask the question well, but you gave me the answer I was looking for right there, Tami, which is that people could see the cost doubling here. Yes. They will know shortly.
Some states have said almost tripling.
Staggering costs. All right, Tami, thank you very much. With us now is Senator Chris Coons, a Democrat from Delaware. Senator, thanks so much for being with us. You hear that estimate where people can have their health care costs doubled. So as you sit here, some 30 days into the shutdown, the government's still not open. There's still not an extension of Obamacare subsidies. So what has been gained in this shutdown?
So, John, this weekend on Saturday, millions of Americans will get their notices about the increase in their health insurance rates. When the tax credits that make the Affordable Care Act affordable expire for millions, they're going to be paying double for health insurance. I've already gotten calls from some folks who I know in other states. In my home state of Delaware, those notices go out in the next couple of days. I'm hopeful that at that point, Republicans will realize this is a crisis, that American health care needs to be accessible and affordable health care, and they'll come to the table. Privately and recently publicly, some Republicans are saying they don't want to see health insurance costs double for millions of Americans. And frankly, John, this will impact every American. If we have millions more people getting their health care through the emergency room, the wait times, which are already too long in the ERs in my state, will increase, and everyone's health insurance rates will go up as the number of people covered and getting preventive care goes down. Donald Trump ran on lowering our costs and making America healthy again. He's doing neither.
But again, as we're 28 plus days into the shutdown, what has that done right now to extend these Obamacare premiums?
Because the House has been out of session the entire time, because our president is out of the country, nothing. Republicans control the House and the Senate and the White House, and they need to come to the table and negotiate about how we're going to deal with this healthcare crisis. What we've accomplished so far with this shutdown, John, is the focus on this being an imminent crisis for the American people.